A smoother road to recovery for patients who develop life-threatening blood clots, including those who have had COVID-19. Our two new surgical techniques, touted as regional firsts, have been introduced by the National University Health System. 13 patients have been treated so far. Natasha Raza with this report.
Every year, around 170 patients at hospitals under NUHS are diagnosed with pulmonary embolism. It's a condition where clots form in the legs, pelvis or abdomen and get dislodged, travelling through the blood vessels to other parts of the body. Sometimes they get stuck in the arteries, blocking the flow of blood to the lungs. About 20% of the local cases are at low risk, while the rest are intermediate or high-risk ones. This prompted doctors to introduce a technique to improve patient care. This tube is inserted into a patient's body to draw out all the blood clots from the lungs.
In the past, we didn't have the right tools. We were only taking patients to the operating room at the last resort. We spent a very long time trying to break up the blood clot because the tools were designed for a tiny little artery, and now suddenly we're dealing in something 10 times larger. But now this is a very viable first-line treatment.
Typically, for intermediate cases of pulmonary embolism, doctors in Singapore inject clot-busting medication into the body. Patients will then spend at least a week in the ICU while waiting for the clots to dissolve. But this method comes with the risk of bleeding in the brain. To tackle this, doctors started using another method involving an ultrasound and a catheter. The tools help insert drugs to dissolve blood clots using less than 25% of the usual blood-busting drug. This lowers the risk involved. The first patient in Southeast Asia to undergo the procedure is Michelle Yip. Last October, she was diagnosed as a high-risk case. After consulting the surgeon, Michelle decided to have the surgery.
I don't feel anything. I don't feel any pain. I don't feel any pain. It's just like you're sleeping, and then everything is over. Like within just less than an hour.
She recovered in just 6 hours and was discharged the next day. This frees up critical ICU beds, which are needed during the pandemic.